On January 3rd of this year, President Obama signed into law a bill requiring more funding for high mortality cancers, with lung and pancreatic cancers given the highest priority status. Joining us this morning to discuss how this will impact our local doctors and patients is Gundersen Lutheran oncologist Dr. Kurt Oettel. Good morning. Thanks for getting up with us.
Good morning. Thank you for having me.
As an oncologist, what does this mean to you, this extra funding?
Well, it's actually not extra funding as much as it's extra emphasis on cancers that are really the most deadly in America, excuse me, particularly lung cancer and pancreatic cancer. And I think what it really means is that we're going to see more of an emphasis on both of these diseases in terms of research, in terms of genetic research, and probably in terms of screening as well. So I think what we hope to see is more people diagnosed with these diseases earlier on in the course of their disease.
Obviously, the President just signed this on the 3rd of January. When would you expect to see some of the changes affect us here in the La Crosse area?
Well, that's it. It's probably going to be a while, because basically what the bill does is it just designates the NCI director to come up with a plan to identify cancers within the first 6 months and then basically reorient some of their resources within 18 months. So I don't think we're going to see changes for a good year or so.
You know, great new screenings are great, but doesn't a lot of this come down to patients too? Patients going to their doctor and when they think something is wrong right away rather than waiting?
Yes, that's absolutely the case. And I think, though, with these two diseases, particularly with lung and with pancreatic cancer, what we really need to see, and what I'm hoping will come out of this bill, is better screening tools, so that once patients do have symptoms, we have a better way to identify who has a disease and who doesn't.
Mm-hmm. How would you expect these new screening tools to impact A, quality of life, but B, the longevity? How long are the survival rates of these two cancers in particular?
Well, both pancreatic cancer and lung cancer have frankly an abysmal 5-year survival rate. Pancreatic cancer almost nothing, lung cancer still around 13%. And what I'd like to see with new screening tools is that their survival rates and their 5-year survival rates to jump at least to 50%, which was what the aim of this bill was targeting at.
5%? Does that equal a lot of lives?
Yes. Well, you think pancreatic cancer, about 40,000 Americans will develop that disease each year, and less than 5% are going to live 5 years with that disease. With lung cancer, 220,000 Americans will develop that disease each year, and about 180,000 are going to die with that disease each year. So those are big numbers.
5% equals a lot of lives saved. Well, Dr. Oettel, thank you so much for joining us this morning to kind of break down this new bill, and best wishes to you and your patients.
Thank you very much. Have a good day.